welcome to the Voice of the Coast. I am your host, Danica. Along with me, we have Dr. Eric Melancon, St. Mary Parish Coroner. Of course, he wears many hats because he is a doctor. So we're going to talk a little bit about everything today. Speaking of which, a little bit about everything, we're actually going to talk about parade safety. Happy Mardi Gras, everyone. So we're in the Mardi Gras spirit, Mardi Gras season. I got on my purple. I'm a little, kind of like, seasonal right now and festive. So let's talk about parade safety and how it is important, particularly staying hydrated.
Well, hydration is very important always, regardless of whatever we're doing. Mardi Gras season, as you know, can either be very warm or very cold. Notoriously, we've been very cold most of the time here in St. Mary Parish. Again, people realize that it's a time of embellishment and things like that, and we just want to make sure everybody's safe. We know there's going to be a lot of alcohol consumed, and just make sure you're pacing yourself and putting in some water every now and then, just like most of those commercials say. I also want to talk about the safety on the parade route. Again, when people are intoxicated, realize they all want to get the throws or the special bead or the hat or the stuffed animal. Just make sure you stay clear of the floats. We don't want to see any tragedies where people actually get run over by floats, especially children. Yeah. So parents, make sure you're keeping an eye on those guys and teach them safety early on. Teach them to stay back. As a rider on a float, it's really difficult to see people, number one. And those people who are closest to the floats, they're even harder to see because you got all this stuff in front of you that you're trying to throw. You're looking at the crowd when you're getting called from many angles. So people who are really close to you, you don't always see. It's usually the people who are further that you can see better because of your mask and everything else.
Right, and that's right. I'm glad you mentioned the mask because it is. You have those small holes trying to look through, and then you don't have a very good peripheral.
What causes tunnel vision? And again, your tunnel vision, unless you're specifically focused on that area, it's not really easy. And again, when people come up to the float, you oftentimes don't even notice them. So stay back, stay safe, and keep the kids back. Everybody should have a really good time. It ought to be a great Mardi Gras, and we're praying for good weather.
Yes. I hate to kind of switch in the middle of what we're talking about Mardi Gras because this here is something that's very, very important. OD deaths and cases, overdoses, and we heard recently, at least within the last month or two, there was at least a 14-year-old where there was a case involving an overdose. Of course, we believe it was just a case; it did not result in a death. But are we kind of having an uptick in overdose?
We've been seeing a whole lot more overdoses. Unfortunately, in the month of December, we had 3, and already this month we've had 1. The 14-year-old was not reported as a death to us at this point, and we're doing a pretty good job at capturing that data, but as of now, no. I'm hoping that young fellow or gentleman or lady did well, and I hope they get some help so that they can fix their addiction.
Yeah, are we seeing, just cases like that? I mean, I know we only had 4, but compared to last year around this time?
We haven't seen a whole lot in the pediatric population. Most of it has been in the young adult, in the 20 to 30-year-old range. We have seen some even all the way up into their 50s and 60s, which, that's a long-term problem. Again, it's out there. There's fentanyl out there, of course, and there's variations of fentanyl. In fact, right now I have some toxicology pending on a case from, I believe, September with a synthetic fentanyl type case. And again, this is all new to us because as these newer synthetic opioids come out, we're learning every day. And there's several of them out there.
Yeah. So of course we have overdoses, but then again, you also take data on suicide deaths.
Yeah, unfortunately, we have seen some suicides. We had a suicide death last month. And again, those things are the most tragic of all because there goes a good life that tends to be taken. And for reasons we never will fully understand and hope that we can try and identify something to help, although it's not that easy. Yeah. Like I said, if you suspect somebody to be at risk, certainly talk to them about it. I know Berwick High School has implemented a program to help with that, and I'm hoping that it actually gets implemented throughout the parish in our high schools and junior high schools.
Yes, and of course there are suicide helplines that you can call as well as text. And we did actually have a suicide walk and awareness organization. I'm not exactly sure if that's still
Yeah, I think when
up and
COVID hit,
going.
it kind of put the damper on a lot of those programs, and hopefully we'll get them started back up this year.
Yeah. Well, of course, when we get back, we're going to talk about what we've been talking about for at least now 3 years, COVID. So we'll talk about how the data is with regards to COVID, and are we on the uphill, downhill? Is a resurgence of it? So coming back right here on the Voice of the Coast. Welcome back to the Voice of the Coast. My guest is Dr. Eric Melancon, St. Mary Parish Coroner. Like I said, we're going to talk about COVID. Oh, COVID, which has been around now for quite some time, and I think we're coming up on the anniversary. I mean,
3
right
years.
around Mardi Gras time, 2020 is when we kind of started hearing about COVID in the United States. Before that, we kind of hearing it in other countries, and now we're back at it again for the 3-year anniversary. I thought we were on our way out, maybe on the downhill, but seems like I'm seeing a lot more masks. People are masked up a little bit more, even locally. So, I mean, what would you say?
Yeah, I mean, we're seeing an uptick in COVID, and as it stands now, COVID is pretty much mimicking the flu. I mean, people with body aches, fever, chills, typically they either have COVID or the flu. There is treatments for both. Obviously, with the flu, we have Tamiflu and Zofluza, for that. And then with COVID, if you meet the criteria, you could be prescribed Paxlovid, which personally in the patients, the few I've used it for those pretty severe, I hadn't found it did much of anything. So that may be something that is really not of any value to us, but I wouldn't recommend not taking it if you met the criteria.
What about antibodies? Is it mitochondrial antibodies?
Mitochondrial antibodies.
Mitochondrial, thank you.
Yeah, I mean, they were using some of that to determine your immunity and things like that, but you can also use it, part of the immunization process was a new way to immunize people. Rather than giving them killed virus, they were giving them the antibody part as already.
Yes. So, of course, you have the flu and you have the COVID. How can you tell which is which?
We have tests. I mean, and typically, you test for one and you test for the other. In fact, we had a period of about 2 weeks when we had run out of flu swabs, and they were on back order, so we couldn't get any. And we tested them for, they came in with the typical flu-like symptoms, and we tested them if they were COVID positive. Obviously, they got treated for COVID. If they were COVID negative, I treated them for the flu, because almost every person who has that constitution of symptoms typically has either COVID or flu. Yeah. Now, there are a few outliers who don't have all the standard stuff and still test positive for either COVID or flu, but that's typical in any year. And
then there's something that was a little atypical, and you said there was one gentleman who had flu-rona.
Actually, I did. I had and early on when they talked about Flurona in California, it made you believe that was some new virus. Yeah. It actually wasn't. And this gentleman, he actually had both coronavirus and influenza virus at the same time. He seemed no worse for the wear, and he did well with his treatment and recovered very quickly within a couple of days, as most people are with either corona or flu.
Yeah. Are we seeing any deaths still? Are they starting to rise, or not many? I mean,
no, we have occasional death. We had 2 last month, and again, those were people who were critically ill with chronic diseases. One was a cancer patient, and the other one had multiple medical problems, including diabetes and heart failure and everything else.
Well, in that case, how can you pinpoint if it was even COVID?
Well, we link it that way because, you have a steady state in chronic disease where people do fairly well, and then any insult, whether it be an illness from coronavirus or influenza virus or a pneumonia, or even, maybe even overdid it one day out in the yard. You can put more strain on the system than those weakened organs can tolerate, and then they succumb to their disease. Yeah. But, it is listed as related to that. It's not necessarily the true cause.
So should we go out and just, have a good time like, good old Louisianians we do around Mardi Gras? I mean, what do you suggest? I mean, how are we supposed to be in preventative mode? I mean, what should we be doing at this point?
I'm not a big fan of preventative mode. Okay. There are some things you should do to help prevent yourself from getting sick. Again, stay hydrated, stay well. If you're up to date on your vaccination status, then you should be good. The newer vaccines and boosters are boosting us against things that we've already probably been exposed to. But, you know, be safe. I don't think you need to be out on a parade route with a mask, but, you know, stay well and stay healthy.
All right, sounds good. Come on back. And something we haven't talked about in a long time, monkeypox? Question mark? Let's talk about it when we get back right here on The Voice of the Coast. Welcome back to The Voice of the Coast. It is I, Danica Long, your host, and we have Dr. Melancon. That was probably not correct English, but that's okay. We're going to move forward. Told you, monkeypox, question mark. We heard it, you know, last year, and you seem to not hear it anymore. What's going on with that?
We hadn't heard a whole lot about it either. You know, monkeypox was a disease that was typically confined to a certain subset of the population. You know, it seems like everything that we get nowadays has been sensationalized by the media and the federal government. You know, we hear about all these the hospitals being at 80% capacity in children with RSV. You know, that's what they were before COVID. So, you know, I don't know. I think we're getting a whole lot more publicity on infectious disease, which in a way is good, but I think the fear tactic is not my method of presentation for the population. You know, I like to educate people on it.
Yeah, I mean, and I'm gonna tell you, I mean, we heard about monkeypox. It definitely caused some fear, and I mean, it was here. It was here. It was definitely something to be aware of, but it wasn't quite as widespread as I think they were kind of maybe pushing or had us to believe.
And like I said, it was confined typically to a certain subset of the population. And again, for the common folk, so to speak, it really didn't play a role in it. There were vaccination events for monkeypox done in Homa, but typically, again, they typically only vaccinated high-risk populations. Which there were some that went ahead and got the vaccination, but at this point, if you feel like you're in at high risk, certainly you can go and ask your Department of Health. Say Mary Parish Health Unit may have some. I don't know that for a fact. I know our Region 3 Department of Health, which is in Homa, I'm sorry, Thibodeau, does have it. So you can contact them over there.
Okay. Are there any other infectious diseases that are kind of coming up and we're starting to see?
Surprisingly, if I look back at my own practice, I've seen quite a few. I say quite a few. I've probably seen 5 or 6 cases of mono in adults. And that's a disease that, you know, typically you see it in kids and the kissing disease. And it's not generally always related to that. But, you know, I've seen probably 5 or 6 cases, and most of them have had some issues with the acute hepatitis. You know, it's not like the other hepatitis, but I mean, it causes irritation of the liver and things like that, and can make people pretty sick. So if you've been feeling bad, and typically it lasts 6, 7, 8 weeks, and you have some belly pain and nausea, certainly go get yourself checked out. It's not as contagious as, say, the flu or corona, but it's still a possibility, and be thinking of it.
That's a long time. I've always heard of it as the kissing disease. I mean, how else can it be contracted?
It's generally transmitted through contact with drinking after one another and things like that, airborne at times.
Okay.
It's not as virulent as a disease, not as contagious, I should say, as, say, the flu and corona.
Okay. Now, I don't know how much of this you have to deal with or know much about, but I guess HPV?
There's HPV out there. There's some new recommendations for HPV vaccination going all the way up to age 45. Personally, as a primary care physician, I do recommend everyone get vaccinated. Best time is for these kids in their teen years, you know, especially young ladies, but the boys should be vaccinated too. Reason girls is because HPV will typically confine to the cervix, and that's something you can't see. Condyloma on young men's genitalia is easy to see, but you know, we want to make sure that we don't increase these young ladies' risk of cervical cancer, and that's probably the #1 cause.
All right. Well, thank you, Doc. We've got one more segment to go. I don't want to go down everything. I was just about to ask you about shingles. We don't need to talk about everything. Just stay safe. Keep yourself healthy. But come on back. I want to talk a little bit more internally and what's going on with the coroner's department. Come on back over to the Voice of the Coast on KWBJ TV 22. Welcome back to the Voice of the Coast. We have Dr. Eric Melancon, St. Mary Parish Coroner. Let's talk about your budget. Let's talk about the money. You have a van that you have already. It looks good, but it's time for another one. Is that right?
The van is surviving for now.
Keep on trucking.
We have a new vehicle on the way. It's a Chevrolet pickup truck. Unfortunately,
Really?
the delays it took to get it cost us about 10 grand more because you know we had on state contract in 2022, but over the course of 3 months now you can't get one of those. You have to do a 2024. And a new state contract puts a Ford vehicle as the replacement, and it's about almost $30,000 more expensive.
Wait, a truck? What about, you're not going to be transporting bodies?
Well, yes, we will, and it'll, you know, the coroner's offices are starting to utilize the trucks more because of their functionality, especially in poor conditions. Most cargo vans, there's only one that has a four-wheel drive capability, and being down here in South Louisiana with hurricane season, four-wheel drive is a must. We've almost been stuck 2 or 3 times in our current van. So to spec that out, the only manufacturer that provides a four-wheel drive cargo van is Mercedes, and that was by far way more expensive than what we wanted to afford. So now the coroner's offices are utilizing, that will need things like four-wheel drive, are utilizing trucks with a steel camper shell to provide the storage and the security and everything else. And it works really well. I mean, I've learned about it on YouTube. A friend of mine sent it to me, said, this is what you need. And I'm looking at it, I'm like, that's actually pretty neat. And its functionality is really, really nice.
Okay.
Plus, it saves us some money.
Yeah. Okay. So when will we see this on the road?
Well, you know, it's on order. The dilemma is that the 2023 model years are out of production already. Because Chevrolet is apparently changing their body styles for 2024 in a 3/4 ton pickup. So I think we can order it next month, and we should have it sometime late April, early May. Okay. We're waiting on the lease option too for the second one, because we actually ordered 2, just because of the way the parish is designed and the need for redundancy in our office.
Okay. And will you continue to see the van on the road too? Will you have both, or
well,
retire
the
it?
van, until we have the second one, will be a backup.
Okay.
Because again, it's starting to have some mechanical issues that, you know, we're able to do, and we keep limping through it and fixing and repair and, you know, duct tape and everything else on it. So, but it's serviced us well, and it's still, you know, very good. It's just, it's time.
I know you have some really good experience on your team, got, you know, a really good crew in there. How about training? Are you looking forward to any new trainings?
We have training fairly regularly. We have the Coroner's Conference coming up in February. And actually I received notification of a training session on officer-involved shootings out of St. Tammany Parish coming up in, I think it's March, end of March.
Interesting.
I haven't talked to my investigators. I got it, I believe, yesterday or the day before. Just didn't have a chance to talk with them and see if we could get one of them to go to it, just so we could educate ourselves.
You know what? Speaking of which, I mean, they typically do a lot of active shooting scenarios and classes and courses locally. Are you guys ever involved?
Not usually. I think that's more for the law enforcement side. We're the cleanup side, so to speak.
Yeah.
Hopefully, we never have anything to clean up, and we don't need to be involved. But certainly would be willing to participate if necessary. And you know, I would like to say we should. That way, in case there was a mass fatality issue, you know, we would be able to set up our you know, task force center and things like that to where we could, you know, notify families and have a place for them to see if one of their loved ones were involved in the shootings.
Okay. Well, thank you. So good to see you in the new year.
It is
And
nice.
hopefully we'll see you. You know what? I think maybe we'll talk a little bit after your training. I like to see what
Good.
some kind of the, you know, some of the new techniques and things that are out there that you were able to adopt for, you know, the coroner's office. So thank you so much for being here. We appreciate it. As always, thank you for joining us on The Voice of the Coast. Make sure to subscribe to us on Facebook. We are KWBJ TV 22, and also check us out on YouTube. Subscribe to us there, KWBJ Live. Y'all take care.